Provera contains the active substance medroxyprogesterone acetate, which is one of a group of medicines called Progestogens. Progestogens are similar to the natural female hormone progesterone. Uses. Provera has several uses. You can take Provera to treat or manage heavy periods, painful periods, irregular periods, or periods that are more frequent than normal. Absence of periods, mild to moderate endometriosis, where tissue from your womb is found outside your womb. You must talk to your doctor if you do not feel better or you feel worse. How to use. Always take this medicine exactly as your doctor or pharmacist has told you. Check with your doctor or pharmacist if you are not sure. Taking Provera for heavy or irregular bleeding and other period problems. You will usually take 2.5 mg to 10 mg for 5 to 10 days, beginning 16 to 21 days after your last period began. Treatment should be given for 2 consecutive cycles. In some cases, your doctor may also prescribe estrogen to be taken at the same time as Provera at doses of 5 to 10 mg for 10 days. A few days after you stop taking the tablets, you may have bleeding like a period, breakthrough bleeding. Taking Provera when you have amenorrhea, when you are not having periods. You will usually take 2.5 mg to 10 mg for 5 to 10 days, beginning on a day which have been calculated or assumed to represent day 16 to day 21 of your menstrual cycle. Repeat the treatment for 3 consecutive cycles. In some cases, your doctor may also prescribe estrogen to be taken at the same time as Provera for 10 days. A few days after you stop taking the tablets, you may have bleeding like a period, breakthrough bleeding. Taking Provera for endometriosis, where tissue from your womb is found outside your womb. You will usually take 10 mg 3 times a day, 30 mg for 3 months, 90 days, starting on the first day of your period. If you have any irregular spotting or bleeding during treatment, this is normal and nothing to worry about. If you forget to take Provera, take the tablet as soon as you remember and carry on taking the tablets at the normal times. If you stop taking Provera, do not stop taking a medicine or alter the dose you are currently taking without seeing your doctor first. It is important to keep taking your medicine. If you have any future questions of the use of this medicine, ask your doctor or pharmacist. Contraindications. Do not take Provera if you are allergic to medroxyprogesterone acetate or other similar hormone medicines, or to any of the other ingredients of this medicine. Are pregnant or think you might be pregnant. Your doctor may give you a pregnancy test before starting treatment, or if you miss a period during treatment. Have now or have had in the past breast cancer. Have now or have had in the past blood clots forming in your veins, venous thrombosis. Have now or have had in the past blood clots forming in your arteries, arterial thrombosis. Have liver problems. Have Provera where your body lacks the ability to correctly produce certain enzymes, and it manifests with either neurological complications or with skin problems, or occasionally both. Warnings and precautions. Talk to a doctor or pharmacist before taking Provera tablets if you have any of the following conditions to help them decide if Provera is suitable for you. Epilepsy, migraine headaches, asthma, heart problems, kidney problems, diabetes, depression or a history of depression, high blood pressure, liver problems, gallstones, systemic lupus erythematosus, an allergic condition which causes joint pain, skin rashes and fever, hearing problems. Provera, especially in high doses, may cause weight gain and fluid retention. Possible side effects. Like all medicines, this medicine can cause side effects, although not everyone gets them. Reasons for stopping Provera treatment immediately. Rarely, Provera may cause a severe allergic reaction which can be life-threatening in some cases. You can get some or all of the following symptoms: wheezing, difficulty breathing, feeling faint, swelling of the face or tongue, hands and feet, intense itchy skin rash. If you think you are reacting badly to the medicine, get emergency medical help immediately. If you get any of the following symptoms, you should stop taking the tablets and see your doctor immediately. These are symptoms of a blood clot in the lungs which may all occur together. Sudden, severe, sharp pain in your chest, coughing up blood, you suddenly become short of breath, your heart beats more rapidly. This can be symptoms of a blood clot in the brain, a stroke. You have an unusually severe or long headache. Your sight is affected in any way. You find it difficult to speak. You collapse or faint. Any part of your body feels weak or numb. These are symptoms of a deep vein thrombosis. You have severe pain, tiredness or swelling in your calf, ankle or foot. You have purple discoloration of the skin of the leg, or the skin becomes red and warm to touch.